Well, heart disease is actually the #1 cause of death in the United States among both men and women. Sometimes people don't know that, but many people, especially seniors, might not even know if they're at risk for it.
This February is American Heart Month, and we're pleased to be joined by Dr. Stephen Angelo. He's the New England Chief Medical Officer with United Healthcare Medicare and Retirement, who can provide a few tips as to how we can reduce our risk for heart disease and enjoy better overall health. Dr. Angelo, thank you so much for joining us.
Thanks for having me. I appreciate being here.
So let's start with some of the very key risk factors for heart disease.
Yeah, when I break it down to my patients, I really try to keep it simple. So there's three major categories of risk factors. Those would be things that are fixed that you can't do anything about, unfortunately.
Yeah.
Modifiable risk factors, such as things like your sleep, your diet, your stress levels. And then there are chronic conditions or health, diseases that can also impact your risks of heart disease.
How important is sleep with people and heart disease?
It's very important, and there's more and more studies coming out now that are demonstrating that poor sleep or not enough sleep can contribute to heart disease overall. So that's something that has been overlooked for some time, but I think we really need to focus in on that again.
Yeah. I know they just recently added it to the 8 things we need to think about with the American Heart Association. But I mean, what are the warning signs? This can get confusing because we've heard before it can be a little different for women than it is for men. But what are the warning signs of some serious heart conditions that we really need to pay attention to?
Yeah, that's a great point to discuss. The warning signs, and also let me back up a bit. We talked about the heart, but we always talk about things such as cardiovascular issues, right? So it's not cardio being the heart, vascular being the blood supply to certain organs like your brain, obviously your heart, and say to your legs and your kidneys. So we really want to be global in our approach because there can be warning signs of all those conditions, right? So, for instance, a stroke the warning signs for that could be problems speaking, numbness or weakness on one side of your body, dizziness, inability to express yourself. So those are things that we get concerned about. The classic signs for a heart attack would be chest pain, it moving into one side of your body. But sometimes it can be non-classical signs such as nausea or dizziness or even just shortness of breath without chest pain.
And for people,
and then the other thing,
go ahead.
The other thing that we also overlook sometimes is something called claudication, which is a sign of atherosclerosis affecting the blood vessels and the blood supply to the leg. So that's also a serious problem that we need to focus in on.
Interesting.
I mean, we hear a lot about cholesterol, and we know we need to get that down.
Right.
There's all these different things out there. But to narrow it down, if you're going to go and spend that 15 minutes with your doctor, we're not getting as much time as we do these days. What are the questions viewers need to ask when they see their doctor?
Right. So hopefully, if you're seeing a good doctor, they'll know all the things they need to screen for. But I'd say the basic things that you should make sure your doctor is looking out for is your blood pressure. Make sure that your blood pressure is being monitored and that they're taking your blood pressure properly in the office. Your BMI, which is your body mass index, and that's simply taking your weight and your height, putting it into a calculation, and then determining whether or not you're obese, overweight, or you're at a good weight. The other thing that's important to do is to have blood work that looks for signs of diabetes. There are tests like glucose tests and the hemoglobin A1C, which it's a test that looks at what your blood sugar is over a long period of time. And then lastly, and most people know this, getting your cholesterol checked, getting those levels of all the bad cholesterol and the good cholesterol is really critical for you to know and for your doctor to know as well.
Mm-hmm.
And I guess we can say always hone in on diet and exercise to keep us a little bit healthier, right?
Absolutely. You should always be working on things like your diet, right? Make small changes, eat more healthily. I love the Mediterranean diet.
Well,
I think it's a wonderful way to approach it. If you're not aware of what it is, look it up. But really reducing the meats and looking more at vegetables and nuts, and also the oils that have that don't have saturated fats.
We talk a lot about that on here, right? Plant-based, a little bit of lean meat and some good olive oil, so can be yummy too. Thank you.
Exactly.
Thanks, doctor.